Well, the FDA announced it will remove warning labels on many hormone therapy drugs used for menopausal and perimenopausal patients. It's a move that could help tens of millions of women. The FDA says the so-called black box warning found on more than 20 hormone-based drugs to treat menopause symptoms is uncalled for.
The companies are, generally speaking, very excited when the FDA tells them you can remove a scary warning.
In 2002, a study found hormone therapy can lead to an increased risk of breast cancer, stroke, blood clots, and dementia. But FDA Commissioner Dr. Marty Makary now says the research was misrepresented and the warning is unnecessary. Health officials point to studies that suggest hormone therapy has few risks when started before age 60 or within 10 years of menopause symptoms.
We're challenging outdated thinking and recommitting to evidence-based medicine that empowers rather than restricts.
Dr. Edwin Ramirez is an OBGYN with Dignity Health. He's joining us live to talk about this now. Thank you so much for being with us this morning.
Thank you for having me.
You know, I feel like this has been a conversation for so long, and I feel like the last few years, a lot of women have been so grateful that there is a renewed conversation around perimenopause and menopause and some of these drugs. Can you talk about what exactly is changing with the warning labels and why it's changing now?
Yes, well, this is very exciting. You know, I've been waiting 20 years for this. As a segue to your question, you know, there was a study called the Women's Health Initiative that happened in the early 2000s, which pretty much scared a lot of the actual providers and the patients at the same time, where it showed that this study represented a group of cohort women that resulted in increased risk for heart disease and breast cancer, as well as clots. Now we're moving 20 years ahead, and we're actually seeing the opposite. We're seeing that these hormones were actually benefiting these patients, decreasing the risk for heart disease, and actually decreasing the risk for breast cancer and improving mental acuity.
Wow.
Interesting, because yeah, as you point to, those studies from 2 decades ago basically say that this therapy would actually increase women's risk of things like cancer and heart risk. So has the science changed? Because some critics are saying they want to see a more widespread study show that.
Well, there's definitely 20 years of data that shows that there's really low, it's a really low risk for developing, you know, all these other comorbidities, and actually improves all-cause mortality. When it comes to mental acuity, you know, there are 2 neurotransmitters in the brain that you may have heard of, dopamine and serotonin.
Yep.
Estrogen actually improves those, and that's why it actually helps with cognitive function. So when women are on estradiol, which is the hormone that we use, studies have shown that there's a 30 to 40% reduction in Alzheimer's later on in life.
Well, and we know women are often impacted by that more than men. So to see this kind of come about, that would make sense. I think there are so many women who are frustrated that this has taken so long to talk about. You said you, as a male doctor, have been waiting 20 years for this. What are you hearing from your patients now as this news is coming about?
So I'm glad you brought that up, because now I'm seeing a new generation of patients, even though I'm old, right? I might look young.
Let them know, Doc.
But I've seen the wave, and I feel like the pendulum is now heading towards our favor. So I see now patients are more willing to accept hormone replacement therapy. And it's exciting because now our hands are not tied behind our back, and patients are willing to trust us.
Yeah.
We developed that trust, but now they're able to trust us even more.
Yeah, what do you say though? Some women are still going to be hesitant. It almost kind of feels like when we do those studies one day that coffee is going to lead to an earlier death, and then the next day drink 10 cups of coffee to live longer. I think the findings here are so opposite of what they were 2 decades ago. How do you comfort people who go, well, how do I know it won't change again?
Well, you know, hormone replacement therapy has been around for more than decades. I mean, I think it's like the 1950s, 1940s is when we started using these type of hormones. Obviously, I was not alive back then. But, you know, medicine has changed so much. And back, you know, the literature does justify, you know what, there's really minimal risk when it comes to hormone replacement therapy, because women, as they grow, they're already producing these hormones. We're just giving it back to them. You know, we're helping them with that transition.
Oh, which is huge, because I mean, you're talking about things, there's like 60 menopausal symptoms, and I feel like I have 50 of them, so I'm very grateful for this conversation. Dr. Ramirez, thank you so much for being with us this morning.
And for looking so young, Dr. Ramirez. Thank you for being with us.